Welcome to my scientifically informed insider look at mental health topics. If you find this video to be interesting or helpful, please like it and subscribe to my channel. Hello, this is Dr. Grande. Today's question is, what are some items that counselors may not know about social anxiety disorder? So I decided to title this video, 4 Things That Counselors May Not Know About Social Anxiety Disorder. And when I use the term counselor here, I'm really talking about anyone who delivers therapy, anyone who delivers psychotherapy as part of their practice. So, of course, that would include professional counselors, but also social workers, psychologists, and generally a number of different psychotherapists. So during my career, I've worked with a number of people from all these different professions, and of course they generally do an excellent job. So this isn't really about how psychotherapists don't understand social anxiety disorder and that makes them terrible therapists, but rather it's just a few elements of social anxiety disorder that I think many counselors wouldn't be aware of. So really the point here is just to offer some knowledge in an area where there may be some deficits. So when we look at the Diagnostic and Statistical Manual, the DSM, we see that there are a number of symptoms associated with social anxiety disorder. We see fear or anxiety in social situations, and specifically this is referring to humiliation, embarrassment, or feeling of rejection. We see that social situations almost always provoke fear or anxiety, so we're not talking about something that's occasional, but something that regularly occurs in social situations. We also see that social situations may be avoided or endured with intense anxiety. So sometimes because of this fear, people will avoid these situations, or if there's no choice, if they have to be in these social situations, it really causes a lot of anxiety. We see that fear or anxiety here is out of proportion to the actual threat. So there is a bit of a threat with social situations. People do have some reason to be a little worried about them. What we're really talking about here with social anxiety disorder is the threat is out of proportion to what could actually happen. And we also see that the symptoms need to be present for 6 months and cause clinically significant distress or impairment. So again, we're not talking about something that's occasional or short-term. So just as is the case with a number of other mental disorders, social anxiety disorder comes at a cost. There's emotional suffering, relationship difficulties, problems with work, especially if work involves social situations. So social anxiety disorder is a serious disorder. It really impacts people's lives in a negative way. So let's get to this list of 4 things that counselors may not know about social anxiety disorder. When we think about this relationship between trauma and this disorder, we often think of the word etiology. If a trauma is etiological, that means it's causal. Now, we believe this relationship does exist to some extent with social anxiety disorder. We do believe that trauma tends to cause or tends to contribute to the development of the disorder, but we really don't know for sure. And we know that it really depends on the type of trauma that we're talking about. There are many types of trauma, and not all of these types are strongly related to social anxiety disorder. When we think of trauma, we think of possible causes for different disorders. We think of a parental style that's over-controlling, overprotective, where we see neglect. We also see different indicators like emotional, physical, and sexual abuse. And we know that these types of abuse and trauma are associated with a number of disorders, like borderline personality disorder, major depressive disorder, post-traumatic stress disorder, conduct disorder, substance use disorder, and panic disorder. And those are just a few of the disorders that have this relationship. But do these same traumas really cause or contribute to social anxiety disorder? Now, interestingly, social anxiety disorder doesn't appear to be significantly related to many of the traumas that I just talked about, many of those factors. The relationship is actually really complex with trauma, but not in the way that a lot of people would think. What we know about social anxiety disorder is that it does appear to be significantly related to a specific type of trauma called social victimization, also called social trauma. And social trauma really has 2 types, and both are related to relationships with peers. Relational trauma and overt trauma. So with relational trauma, we're talking about bullying, exclusion, and neglect, again, all in the context of peers. And with overt trauma, we're talking about physical and verbal aggression. So we know there's this overlap with emotional and physical abuse, but social victimization is really thought of as distinct. And although trauma may be thought of as a distal predisposing factor that's related to social anxiety disorder, social victimization or social trauma is the most proximal risk for social anxiety disorder and the most proximal risk for maintaining the disorder. So with trauma and social anxiety disorder, it's just important to understand this complex relationship, and I think that's what a lot of counselors aren't aware of. The second item that most counselors aren't aware of with social anxiety disorder is understanding the chronic nature of the disorder. We know that with a number of mental disorders, we of course do consider them to be chronic, that is, long-lasting. For example, we wouldn't expect to treat somebody with major depressive disorder and to see those symptoms go away within a few days or a few weeks. Now, major depressive disorder does have a cyclic nature to it. It's episodic. So, of course, that means, in a way, symptoms tend to come and go. But the pattern of episodes, we would expect that to last a long time. And I think what happens with social anxiety disorder is there's this idea that maybe the disorder only lasts for a few months or maybe a few years, and then it goes into permanent remission. And that's just not how social anxiety disorder really works. Now, we know from the definition of social anxiety disorder that the symptoms have to be around for at least 6 months. And again, this tends to point to the idea that it's chronic. But I think what happens here with social anxiety disorder is that individuals have symptoms when stressors are present, and then sometimes those stressors go away. So, for example, somebody might be in a role working at an employer where they have a lot of contact with people, so social situations, and we see a lot of symptoms. But then their job may change. They may change jobs altogether, or their role within that company may change, and the symptoms disappear. But the tendency is still there. So if they're being treated, a counselor may be tempted to say, well, it seems like you've beaten social anxiety disorder. It's gone. But then that same counselor is surprised if the symptoms return in a few months. It seems like the client got over the disorder, somehow beat the disorder, and then it came back. But that's not what's happening. The disorder was there the whole time. The tendency was there. We know that with social anxiety disorder, the tendency to be socially anxious is better conceptualized as a trait. It's better to think of it as a trait, something that's stable, and not as a state, something that's temporary. So I think this is where we get into confusion and understanding the nature of social anxiety disorder and how it can appear to be episodic, but it's really the stressors that come and go. And the social anxiety disorder is really just keeping pace with those stressors. So again, social anxiety disorder is chronic, but that doesn't mean that for some people it won't go into remission through therapy, like cognitive behavioral therapy or exposure therapy. Someone can improve a lot with the symptoms and manage the disorder a lot better. So this isn't a point where people should get discouraged. Rather, it's just understanding the chronic nature of the disorder. So the third item that counselors may not understand about social anxiety disorder is the importance and the role of exposure therapy. Now, every clinician has different modalities, different ways of treating clients that they tend to like. For example, I like cognitive behavioral therapy. A lot of counselors like Gestalt therapy, psychodynamic therapy. And what happens is they tend to use these modalities, and they tend to prefer them over other modalities, even when certain modalities are strongly indicated for certain disorders. And this is what we see with exposure therapy. Exposure therapy is not effective for every type of mental disorder, but generally it's quite effective for social anxiety disorder and a few other disorders. So I think even if a counselor has a preference for a particular modality, it's important to at least consider using exposure therapy. So if exposure therapy is so effective for this disorder, why do counselors not use it? Well, other than having a preferred modality, I think what happens is with exposure therapy, there is an increased amount of suffering early on, right? The exposure causes anxiety itself. And understandably, counselors don't want to add more stress to a client. It's important to understand, though, that with exposure therapy, that's only temporary, and then we usually start to see really significant gains, significant improvements. So, yes, exposure therapy itself comes at a cost, just like social anxiety disorder, but in the end, it does tend to work fairly well. And I think it should be given more consideration generally than it is. Exposure therapy is no different than any other therapy in the sense that it has to be used responsibly when it's used. All therapies have that potential of causing more stress. All of them come with some risk. It's about managing that risk and trying to get to the rewards. So the fourth item that most counselors may not know about social anxiety disorder is how to use the panic attack specifier. As a matter of fact, I've met many counselors in my career that didn't even know the panic attack specifier existed. So the word panic actually doesn't appear anywhere in the definition of social anxiety disorder. So panic tends to be comorbid with social anxiety disorder, meaning we tend to see panic attacks in a lot of people who have the disorder. But it's not necessary for a diagnosis of social anxiety disorder. So the panic attack specifier is supposed to be used when somebody has a disorder and they also meet the criteria for the panic attack specifier. So again, this is a specifier. It adds information to a diagnosis. It's not a diagnosis itself. And to make this more confusing, the panic attack specifier isn't listed right next to social anxiety disorder in the DSM. It's listed off by itself. Now we do see another specifier that is with social anxiety disorder. That's performance only. That's when the symptoms of the disorder are mostly around when somebody has performance situations like public speaking. But of course that's different than the panic attack specifier. What makes the panic attack specifier really interesting is that it can be applied to any mental disorder in the DSM except for panic disorder, because with panic disorder you already have the symptoms of a panic attack. Now of course we wouldn't expect to see a panic attack specifier with some mental disorders, but with other mental disorders it's fairly common, like PTSD, substance use disorders, and generalized anxiety disorder. With those disorders there's an increased risk of panic symptoms. So if an individual has social anxiety disorder and they have panic attacks, if they meet the full criteria for both of those, the mental disorder, social anxiety disorder, and the specifier, panic attacks, then that specifier would be added to the disorder. So it would read social anxiety disorder with panic attacks. And this is what doesn't happen a lot of times I see in clinical practice. Clinicians will say, oh yes, that person has social anxiety disorder, so of course they have panic attacks. Again, some presentations don't have the panic attacks. That's what the specifier is for, and the specifier is required when panic attacks are present. So those are 4 items that counselors may not know about social anxiety disorder. If you have experience with this disorder, if you have it or know someone who has it, or you're a clinician and you work with it, and you feel there's some other items that I could have added to this list, I'm sure there really are actually, please put those in the comments. I'd like to see those. I think this could generate an interesting discussion. It's certainly a disorder that affects a lot of people, and again, it comes at a cost. So anything that we could do to become more effective at treating it would be a healthy pursuit. As always, I hope you found this video on social anxiety disorder to be interesting. Thanks for watching.